everyone, I'm Matias Gonzalez from GlycoX, solving diabetes, creating a treatment that is an alternative to insulin and Ozempic that actually addresses the major diabetic complications. Today, over 1 in 10 adults globally suffers from diabetes. They have lost control over their blood glucose, colloquially known as blood sugar. Most of us, when we eat, we have a slight spike of glucose, but that mostly remains in a healthy range, compared to non-treated diabetics, shown here in red, where their glucose is constantly in an elevated and dangerous zone, as it causes damage to their organs. For example, the nervous system, the muscles, and the circulatory system. Current treatments, like insulin and Ozempic, have transformed diabetes from fatal to manageable. However, most diabetics remain in a state of chronic hyperglycemia, or they risk hypoglycemia, low blood glucose. And that quickly becomes dangerous because the brain needs glucose to function. Glucose control is central, but diabetes is much more. Diabetes is a complex chronic disease that also involves inflammation, oxidation, and muscle loss. Current treatments fail at properly controlling glucose, and they also fail to address these other underlying complications. Moreover, most diabetics do not even use the best treatments because they're not practical. For example, requiring injections, as well as being unaffordable. This leaves diabetics losing over a decade of life and even longer in health span. 12 years ago, while studying different Brazilian plants to see how they can help with heart disease, our scientist Robson was able to find that one of those Brazilian plants was actually able to properly control glucose. More recently, our team is able to pinpoint the specific chemical compounds responsible for these effects, allowing us to scale the solution. We've been testing in diabetic animals, and the tested diabetic animals actually had a very rapid normalization of their glucose, equally fast or faster than the non-diabetic controls. And none of them had any issue with hypoglycemia, regardless of the dose that we tested. We've also noticed that this product is a strong antioxidant and a strong anti-inflammatory agent. As well as most diabetics lose a significant amount of muscle mass, accelerating their health decline. And in our diabetic animals, they actually retained the same amount of muscle mass and lost a significant amount of fat. And so this is why we believe GlycoX is the only solution that is properly addressing all the different complications of diabetes. So first, properly controlling glucose, so no hyper or hypoglycemia. Second, being a potent antioxidant and an anti-inflammatory agent. Third, being able to retain muscle mass while accelerating fat loss. And fourth, being an affordable pill. This will actually be addressable and be able for people to actually use. And so this is how we think that we will revolutionize the diabetes treatment, by preserving what current treatments don't. So their health, their organs, and more important, their years of life lost to diabetes complications. We have a strong team with over a decade of experience of studying these compounds to try and solve diabetes, as well as experience in scaling biotech and healthcare startups in the US. We're currently doing preclinical work, and we're going to be getting a formulation patent, in the middle of this year, which will allow us to accelerate the conversations with the manufacturers as well as get the IND going, which is a necessary step with the FDA to be able to do the human clinical trials. Later this year, we're going to be doing a fundraising round of about $2 million to be able to finalize the preclinical studies as well as apply for the IND. And we have an ambitious goal of doing the human clinical trials next year and going to market in the 2030s. Thank you so much for your time, and we're excited to talk to you on how together we can solve diabetes.